Is this ptosis and can it be cured? I am 22 years old and noticed a recent change to my eyes where one looks significantly larger than the other. The right eyelid has dropped, and the other seems to give off a staring and bulgy appearance. It's only become noticeable, this bad, over the last few weeks. I went to the doctor and was diagnosed with thyroid issues. I asked if this could be related, but she didn't give me any info. I am now on medication and changed my diet completely. Will this help my eyes? What can I do?
Thank you for your question. You're 22 years old and you've described very well in detail with this one photo that you submitted how one eye is drooping and the other eye is starting to look bulging and staring, and that you have seen your doctor and you were diagnosed with thyroid issues and you're on medication. So I think that what you're going to be learning about and what this appears to be is a situation called thyroid-related immune orbitopathy. Just to give you some background, I'm a board-certified cosmetic surgeon, but with background original training in eye surgery, followed by training in oculoplastic surgery, which is surgery of the eyelids, orbit, lacrimal system, and we specialize in thyroid-related eye disease. So what the term that's typically used in our field is thyroid-related immune orbitopathy, or TRIO. Another term that's more commonly used because is Graves' disease. What this is a disease which is caused by an autoimmune response that is these antibodies that affect both the thyroid and the soft tissue of the eyes. A lot of times people believe that the thyroid is affected by either secreting too much thyroid hormone called hyperthyroid, or you can have in this disease you can have high thyroid, low thyroid, or hypothyroid, or you can be normal thyroid or euthyroid. But there's often a misunderstanding that there's a direct relationship between the thyroid hormone and the changes in the eyes. It's not the case. The thyroid and the eyes are affected by the antibodies, and what's happening is that your endocrinologist will manage you with either medication or maybe even something called radioactive iodine to reduce the thyroid depending on what happens with your thyroid hormone. The eye changes will occur regardless, even though there has been some studies that have shown that when the thyroid level is very high, the eye changes are also worse. But a person can have very well controlled thyroid, but their eye changes can go on for years. In general, the understanding is that most thyroid-related immune disease is divided into two stages. One is called the inflammatory stage, and the other is called the fibrotic stage. The inflammatory stage is the stage you're in right now, where there is continuous changes in the eye shape, and the eye may push forward, the eye may become very red, the eyes may retract, and staring appearance will occur. But it's a time of variability, and there's a lot of different options for how to manage depending on how the eyes are affected. Management options include nothing or observation, the use of steroids, as well as the use of radiation. And this will be determined by you and your doctors as things develop. When we talk about surgical options, we wait for the stage called the fibrotic stage. The one exception, of course, is if the inflammatory stage occurs where I should go back and explain that the inflammatory stage it affects the muscles of the eyes as well as the fat around the eyes. It also affects the eyelids, and that's why that the eyes can even not bulge out, but the eyelids can open and become very retracted. During this inflammatory stage, there's, like I said, there's continuous changes. There's a time where the disease finally burns out, and it becomes what's called the fibrotic stage. And that's a stage when the appearance becomes more stable. Now, the time frame is that this inflammatory stage can last up to 5 years, but in typical clinical experience, it will last somewhere up to 2 years. And the way we determine stability is by doing measurements of the relative position of the eye called exophthalmometry, as well as continuous examination and photography to make sure that your eyes are stable. Once they are stable, we have many different surgical options, such as the treatment of eyelid retraction and the treatment of eye position. So there will be options, but there are many patients, just to balance this out, whose eyes don't need surgery. They will resolve to the point where if it's known that you had thyroid eye disease, there's no obvious signs. So there's a wide spectrum, and then there's people on the other side who have very bulgy eyes, or their eyes are crossed, or that they have one eye retracted, one eyelid higher than the other. This is unfortunately a disease that affects a lot of people, particularly women who tend to be younger, and it can be very emotionally devastating. So it is no question, but you are in good company because a lot of people have experienced this, and I've been in practice for over 20 years, so I've kind of been through this process with a lot of people. It's important that you continue to do what you're doing with your medical doctors, but don't be too eager to do surgery too early. Thyroid eye disease, the only true indication that I've ever operated on for somebody was when their optic nerve, or the nerve that supplies their eyes, was getting compressed, or if they were developing such exposure that the cornea, the front of the eye, was becoming compromised. Otherwise, we try to avoid doing surgery until the fibrotic stage. So I think you're on the right track in terms of doing your research, but just don't do anything too early or without the consensus and the awareness that your disease process has been stabilized. So I hope that was helpful. I wish you the best of luck, and thank you for your question.